A major announcement from the White House that's happening right now, linking autism to the use of acetaminophen, which is the generic name for Tylenol.
First, effective immediately, the FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Is that okay?
You are listening to Equity Matters, where we champion equity in every conversation. I'm Dr. James Bell III, public health leader, storyteller, and I believe the stories we tell are just as powerful as the policies we shape. So let's get into today's conversation. We need to dig into this concept of misinformation because it is not harmless by any means. We saw it during COVID, where people refused life-saving vaccines because of what they read online. And we see it now with claims tying Tylenol to autism, and it's ultimately spreading fear without evidence. And the danger here isn't just bad science, it's actually the mistrust that it creates and the programs and research and operations, if you will, that it informs. When people don't know who or what to believe, unfortunately, communities are left vulnerable, and institutions we need in times of crisis lose credibility. We saw this with the CDC. We saw this with WHO. We see this all the time. And even more personally for me, as a father of a child with autism, I've often asked myself, can I trust the advice that I'm giving? Can I trust the institutions making these recommendations? And the answer isn't always simple. And history shows us why. Mistrust exists because the history of medicine isn't just about breakthroughs. It's actually built on betrayals of trust. You have communities, especially Black, Indigenous, and poor communities, that have often been treated as subjects of experimentation rather than partners in care. You think about the science that's been built on exploitation. Many of the quote unquote founding fathers of science and medicine were white men who owned slaves, who benefited from systemic racism, and really advanced their work at the direct expense of marginalized people. You used enslaved Black people as tools, right? They were used without consent in medical experimentation. If you're familiar with the work of J. Marion Sims, the father of modern gynecology, he experimented on enslaved women without anesthesia. And this is literally living in our DNA today and shows up in the way that the practice has evolved. There's also this legacy of white supremacy in science. You know, you think about what gets funded, who gets studied, whose voices are centered. All of that historically has been shaped by white men who have both access to power and an interest in maintaining it. And what this tells us today is that communities remember these abuses. They pass down stories. They tell you which doctors to go to, which hospitals to avoid. So when new claims emerge about medicine, you like this Tylenol and autism, people's skepticism isn't just about the present. It's literally baked into the centuries of exploitation and exclusion. One of the key examples that we often reference is the Tuskegee syphilis study. So you had from 1932 to 1972, 40 years, the U.S. Public Health Service ran a study in Tuskegee, Alabama to observe the progression of untreated syphilis in Black men. You had about 600 Black men enrolled, 399 had syphilis, 201 did not. And they were mostly poor sharecroppers with little access to health care. These men were told that they were being treated for bad blood. And they weren't told that they had syphilis, and they were not told that they were part of a study. So if this started in 1932, and by the 1940s, penicillin became the standard treatment for syphilis, but the men in this study were intentionally denied access to it so researchers could observe the disease. You had Black doctors and nurses who were also recruited to give the study credibility and make participants feel safe when in fact they were being exploited. You ask yourself what happened. Well, you know what happened. Many men died from syphilis related complications. Some infected their wives, their children were born with congenital syphilis, and all of these things are preventable with treatment. And even after shutting down in 1972, so that 40 years, that damage had already been done. And it really cemented this deep mistrust of government, medicine, and science in Black communities. This is why we see vaccine hesitancy now. And there's other atrocities that I think that we could mention. Forced sterilization, for example. Around the same time, you had a whole community experiencing forced sterilization. One of my favorites, Fannie Lou Hamer, she coined the term Mississippi appendectomy to describe this widespread phenomena of Black women in the South who were sterilized under force under the guise of medical care. And so around, like I said, around that same time, it's the 40s to the 70s, there was targeted sterilization of poor women, women of color, indigenous and disabled women. And it was like women would go to the hospital for a minor procedure, like to get their tonsils removed, or even something significant like childbirth, and would be sterilized without their consent. And so doctors would justify it by saying that women were unfit to reproduce. And they would use eugenic inspired ideas to justify it. And when I was researching for the episode, I saw in Mississippi alone, thousands of Black women were sterilized without their knowledge. But nationwide, it's estimated that about 60,000 people were sterilized under state eugenics programs. And so you can't talk about misinformation without also talking about mistrust, because these are real experiences and not some like abstract history. They literally shape why communities sometimes question medical guidance today. And so here you have it. Tuskegee showed how Black men were deceived and denied treatment. These Mississippi appendectomies show how Black women were violated and stripped of choice. And together they formed just a legacy of betrayal that makes today's communities vulnerable to junk science. And so if you've taken an intro to science, statistics, or even a high school research class, you've probably heard the phrase correlation does not mean causation. It's one of the first things we're taught. Correlation is two things happening around the same time, where causation is one thing directly causes the other. So for my sneakerheads out there, think of it this way. Say every time a new pair of J's drop, the high school graduation rate goes up. Does that mean that Jordans make you graduate? No, it's just a coincidence. And that's what leaves us with junk science, because information that sounds scientific, but it isn't backed by rigorous evidence, is not peer reviewed, it doesn't have reproducible results, it often relies on these shaky correlations, it relies on bad data, and also cherry-picked studies. What is going to align with what I am trying to create as my messaging? And a lot of junk science comes from mistaking correlation for causation, because junk science is actually designed to trigger your emotions, because it tugs at fear. It gets at the uncertainty or the anger, and it really gives people, it gives simple answers to complex problems, especially if they're for interested parties looking for something or someone to blame. It dresses itself up in the language of science, of graphs, of citations, and even lab coats, when the actual data itself doesn't hold up. And this is problematic because people believe it. We are battling with the human desire for certainty when faced with uncertainty. I get it. I get it. And ultimately, this causes harm. There's some broader social implications with this junk science, because misinformation and mistrust have ripple effects that cost lives. It divides communities, and it ultimately, from my public health standpoint, it deepens systemic inequities. You had, during the COVID pandemic, Misinformation pushed some people to drink bleach. And then you have folks who were using ivermectin. The thing about ivermectin at that time is it's FDA approved, right? It's a drug for specific human and animal, point that out, parasitic infections, things like lice, right? And parasitic worms. It's not authorized or approved as an antiviral medication for COVID. And if you did the research, you saw that there were multiple large, well-designed, randomized controlled trials that showed no clinical benefit from using it. And I think, there was consensus from the medical community, and there was overwhelming guidance against ivermectin, but misinformation made it so that people saw this as an opportunity to treat COVID-19. The challenge with this is you have to find balance in recognizing that while some will refuse life-saving vaccines because they don't trust the system, it's going to lead to higher death rates in communities that are already hit hardest by the virus or by a virus or whatever we're talking about here. It exploits vulnerable communities. You have people selling snake oil. Is what this boils down to. This is predatory figures, bad actors using fear to sell miracle cures and conspiracies. They are literally profiting off of suffering. But why are we here today? Because we have a president who has trouble with big words. As a Black father raising a Black child with autism, I carry both the weight of history and the urgency of now. So trust me, I understand why people mistrust, because history has taught us to ask hard questions. But mistrust, while it can be justified, it can also make us vulnerable to junk science. When you're a parent, you'll Google anything at 2 a.m. I've been there. And here's the scary part. Some of what you find, it looks scientific, it looks and sounds convincing, but it's junk. And if you're not careful, this junk science can shape the choices that you make for your family. This is why misinformation is dangerous. It doesn't just spread on lies because it plays on your fears. It wants you to believe these things. So let's be clear for a moment. The studies people tend to cite are mostly observational. That means that you have researchers who look at trends in populations, for instance, who took Tylenol during pregnancy, who didn't, and see if autism rates differ. Those observational studies, they can suggest correlations, but they do not prove causation. There's just too many factors: genetics, environment, prenatal health, social economic status, that could explain those patterns. And you contrast that with rigorous clinical research, those controlled experiments, randomization, peer review, replication. That is the gold standard. And in this case, hear me clearly, there's no clinical research showing Tylenol causes autism. As someone who spent the greater part of my first half of parenting Googling why did this happen to my child, I know. I had too many reasons and justifications in my mind about how did we get here. You have headlines and social media posts and public announcements that just simplify and distort findings. A one-page observational study suddenly becomes Tylenol causes autism, and it spreads like wildfire. You lose the nuance. You don't hear about the uncertainty or the limitations and the caveats because none of that is going to make it into the viral post. I wanted to call this episode Critical Thinking because some of us are missing the point. We know how junk science and misinformation spreads. But let's talk about how we protect ourselves and ultimately rebuild trust. Whatever the topic is, you need to consult some trusted experts. People that you trust. No one says that you have to trust what the CDC says if you have a doctor that you trust in your backyard. If we're talking about autism and Tylenol, for example, talk to your child's pediatrician. Talk to a specialist. Talk to academic researchers who are transparent about their evidence and limitations. If there's one thing that academics like, is talking about their research. And you got to check the sources. Sure, I'm prepared through a doctoral program and I have access to some advanced libraries, but do yourself a favor and don't just read the headline. See if you can access the original study. See who funded it. See whether it was peer reviewed. I'm not asking you to read a peer reviewed journal, but even if you take a glance at the abstract, you can tell whether the research is observational, experimental, or speculative. And honestly, it's okay to be skeptical. I want more of us to be skeptical. Healthy skepticism is key, but that does not mean panic. It's about asking questions and not always assuming the worst. Because at the end of the day, misinformation isn't just noise. It's actually a threat because it thrives on our fears. It takes advantage of our history and it exploits the cracks in our trust. But the answer isn't to turn away from science or from each other. It's actually to demand better. You want better research. You want better communication. You want better accountability. And most importantly, you want better listening. And that's what we're here to do. That's what Equity Matters is here to do. To keep that conversation going. Because equity does not live in isolation. It takes all of us. It takes all of our gifts, our talents, and our resources. I want to give a special thanks to those who have been sharing these episodes. I am on a generational run right now. I want to keep it going. I want to give a shout out to Javon Reese, a mentee of mine, a Black social worker doing his thing. We ran into each other at the Michigan Environmental Justice Conference, and just him sharing the value of my podcast was so great to hear. It means the world to me, and this is how community grows. Remember, you can stay connected with Equity Matters wherever you listen to podcasts. Follow along on social media to keep that dialogue alive. And be sure to tune in for the next episode where we'll be digging into a different kind of era of misinformation. And we're looking at the militarization of communities like Portland, Chicago, DC, and how power and fear shape the stories we're told. This has been Equity Matters, because equity always matters.